The decision made by President Cyril Ramaphosa to sign the National Health Insurance Bill, the NHI, into law has had a significant impact on the shares of Discovery, the country's largest medical insurer, causing them to take quite a dip. The bill aims to provide universal healthcare through a state-run fund, effectively banning the private sector from financing treatment covered under the plan. This move has raised concerns among the private healthcare sectors. The announcement by President Ramaphosa led to a significant decline in the shares of Discovery, with the company's stock price plummeting 22% so far this year. More recently, the shares dropped as much as 7.4% in a single day, the most since March, with the company's peers, including Momentum Metropolitan Holdings, Sanlam, and Old Mutual, also experiencing a decline. This move has raised concerns among investors, with many expressing their uncertainty about the future of the private healthcare sector in South Africa. The NHI Bill proposes a state-run fund to provide universal healthcare, which could potentially limit the role of private healthcare providers. While the intention is to ensure equal access to healthcare for all, the bill's approach has raised concerns amongst private healthcare stakeholders. Dr. Ryan Noach, CEO of Discovery, has expressed reservations about the bill's potential impact on the private healthcare sector, highlighting the importance of a multi-funded environment that encourages diversity and innovation. The company's South African health business, which accounts for approximately 34% of its earnings, could be significantly affected by the bill's provisions. Dr. Noach has urged calm and perspective on the National Health Insurance Bill, emphasizing that its implementation will be a lengthy process and that significant uncertainties still surround its funding mechanisms. While acknowledging the bill's ambitious goals, Dr. Noach has also expressed concerns about the potential exodus of medical professionals from the public sector, which could exacerbate the existing shortage of skilled healthcare workers. To mitigate this risk, he advocates for a multi-funded environment that allows both public and private healthcare providers to coexist and complement each other's services. This approach, he believes, will ensure a more sustainable and equitable healthcare system for all South Africans. The Democratic Alliance has vowed to take legal action against the NHI Bill once it is enacted, citing grave concerns about its constitutionality and the government's disregard for public input during the legislative process. The DA argues that the bill infringes on citizens' rights to access quality healthcare and violates the principles of accountability and transparency. This move has sparked anxiety among some private healthcare stakeholders who fear the bill's implementation could lead to a state-dominated healthcare system, potentially jeopardizing the future of private healthcare provision and the livelihoods of thousands of healthcare workers. The NHI Bill has sparked widespread unease amongst private healthcare stakeholders who fear its far-reaching implications for the sector's future. While the bill's proponents tout its potential to expand access to healthcare, critics argue that its draconian provisions and lack of clarity on key details threaten to destabilize the entire healthcare system. As the private healthcare insurance industry prepares for a potentially seismic shift, many are left wondering if the government's gambit will ultimately improve healthcare outcomes or simply create a new set of problems. With the future of South Africa's healthcare system hanging precariously in the balance, only time will reveal the true consequences of this controversial legislation. The NHI Bill's funding remains a significant uncertainty, with no clear plans in place for how it will be funded. The bill's complementary financing legislation and regulation from the National Treasury have not been published, and the Minister of Finance has made little reference to the NHI in his budget speech. This lack of clarity has raised concerns among the private healthcare sector, with many expressing their uncertainty about the future of the sector. While there are many uncertainties surrounding the bill's potential implementation and funding, one thing is clear: the future of South Africa's healthcare system hangs in the balance. The private medical insurance industry is bracing itself for potential significant changes ahead, and only time will tell what the future holds for the sector if the bill is signed into law. Do subscribe to my YouTube channel, as I have a few more stories to tell. I will see you in the next video.